comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole, Jacinto. Join us on Healthline with 𝗏𝗏𝗵𝗹 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗵𝗹. For a healthier and uplifting lifestyle, tune into Healthline with 𝗏𝗏𝗵𝗹 on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗏𝗏𝗵𝗹 every Monday from 5 p.m. to 6:30 p.m. airing on Sky Cable Channel 224 and on all DTT boxes, simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗵𝗹 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗵𝗹. I'm your host, Nicole Jacinto. Today, we're going to talk about proper kidney care, and our guest is Dr. Sarmiento. Good afternoon, Dr. Sarmiento. How are you doing?
Hi, good afternoon, Nicole. Good afternoon, everyone. Thank you for having me.
Well, thank you for being on the show. Actually, proper kidney care is, for me personally, it's very important. So I'm gonna throw you a lot of questions today, and I'm yes, of course. And then, so you're a nephrologist or a nephrology specialist, so you're the right person to talk to about this. And also, to those of you out there, if you have questions for Dr. Sarmiento, please send in the clowns. Haha, just kidding. Send in the questions during the show while we're live so that Dr. Sarmiento can answer them directly. But if not, don't worry about it because, as I said, I have so many questions. We're going to go through it very thoroughly. I can already tell that Dr. Sarmiento is probably one of those people that you can get so much information from. You got that professor vibe, and I really like that, doctor, because I like learning, and I hope that everyone else can learn from the show, whether or not they suffer from kidney problems, if they know other people. I think it's just really very important and something that we haven't taken up as much in the past few years. So anyway, don't worry, folks, you can go through the show over and over again. You can watch it on Radio Bandido TV on DZRJ 8:10 a.m. Radio Bandido. You can listen, you can watch. It's on different channels, and it's of course on YouTube, Facebook. We're everywhere, and you can go and you can watch a show anytime, anywhere in the world. And that reminds me, if I have to say hi to some people later, but for now, let's get down to it, Dr. Sarmiento. Okay, Dr. Sarmiento, can you tell us what the primary functions of the kidneys are?
Okay, Nicole, our kidney is a bean-shaped structure in our body. It's a bean-shaped organ located in the back of our body. Its function is primarily to remove excess of water that's not needed by the body, and also to remove the waste product that is generated by the body every day. Because, Nicole, every day, in the process of living, our body creates waste product that should be excreted out, and the kidney does that function. So in other words, our kidneys acts like a janitor of our body, So it's important that we have those function intact, otherwise we'll be flooded with problems.
Thank you, doctor. Okay, I'm so glad you mentioned it's bean shaped, so it looks like
a bean, yeah.
Something that a cannibal might want to eat. Anyway, but yeah, it looks like a bean, and then so basically, the kidneys filter out the toxins in our body. Is it part of the excretory system, or
Yes.
other parts of? Sorry, go ahead, doctor.
Yeah, it's a part of excretory system, the kidney, once the waste product and water is filtered, it comes out in our body based on our urine, kidney function, and it becomes the urine, So when we excrete our urine, it contains the waste product that are not needed anymore, that are not needed by the body, and also the water, the excess water that's also not needed by the body to maintain the balance in our system, So if we have an intact kidney functioning, we don't develop the edema or the manas in Tagalog, no? We don't develop weakness because the body is able to excrete those waste products. So it's good that when we have good kidney function, we are able to excrete urine on a regular basis.
Okay. Yeah. And then also I have just a quick question. Urine is sterile when it comes out of the body, right?
Yes. Mhm.
Okay. Just wanted to see. Now I have an excuse to, like, I could pee on your foot and it's sterile. Okay. All right. So, doctor, thank you for explaining to us what the primary functions of the kidney or kidneys are. Now, okay. Why do we have two kidneys, or rather, like, how do the two kidneys function in conjunction? Because, like, my grandmother was born with one kidney, and she obviously she survived into her 70s. She did not have a kidney problem, but I mean, I guess, through evolution you have two kidneys. But can you explain to us, like, how they work together? Because some people will say, well, you only need one kidney. So why is it better to have two, or does one just work on its own? Is the other a reserve? There are questions like that. Could you tell us a bit about that, doctor?
Yeah, that's right, Nicole. Most of us were born with two kidneys, no, left and right kidney, and each of that shared would have a 50% kidney functioning, 50% on the right and 50% of the left. So, other words, we have a total of 100% kidney functioning. But there are some people who were born with just one kidney, no. So we call that a single functioning kidney, and that's all right, no, because we can live with just one kidney. Because what will happen? Once only one kidney is functioning, it will take over the function of the remaining kidney. In other words, it will overwork, no? It will try to compensate for the absence of the other kidney. So it's just like two co-workers. If the other co-workers is absent, then the remaining worker will do double its effort, no? So that's why in our practice of kidney transplantation and nephrology, we always advise the prospective donor that it's all right to donate your kidney, no, because that kidney will also compensate for the absence of the other kidney. So eventually it will increase its functioning, but there's also a caveat to that. We don't want that remaining kidney to overfunction. Otherwise, eventually it will anything that you exhaust, no, eventually it will become inflamed, and eventually they will develop fibrosis. So eventually that kidney function will also go down in function. So how do we do that? Of course, you have to control your weight. You have to control your diet. Also, it does not mean that you have one kidney that you don't take care of it. No, so you still practice what's necessary, huh? Mm-hmm.
Yes, thank you, doctor, for clarifying that. Because yes, when it comes to transplants, someone will donate their kidney, and that person also has to then be more conscious of taking care of the one kidney they had left. And I like how you mentioned, like, it's a fact you mentioned, you also don't want to overwork an organ. And if there's only one kidney left, as you said, there could be like fibrosis, so there would be scarring or something, and then you yourself could develop a kidney problem, or it's always better to have two, because they're supposed to share the function. So, doctor, I mean, considering the primary function of the kidney and everything, or the kidneys and everything you've just like explained to us, do you find, like, can you tell us why we should be actively aware about kidneys and kidney health? Because I'll go off on it. Personally, I think it's kind of taken for granted. A lot. I myself do it. It's like, let me, doctor, like, over.
Yes, I got your question. Yeah. Okay, so it's like this. So basically, you're asking how we can take care of our kidney, no? So and the parameters that we need to monitor. So once because our kidney has a finite number, no, we were born with a certain number of kidney. It's not like the liver, so that it can regenerate, no. Once we remove a certain, but it can regenerate. In kidneys, there's a finite limited number. So once it is a fibrotic or has scarred already, then it becomes non-functional. But all of those kidney diseases are preventable, no. You just need to control your blood pressure, control your sugar, control your weight, no, those are preventable because once more often than not, once you develop signs of like weakness, body malaise, nausea, you're already in the late stage of the kidney disease. So sometimes you don't develop any symptoms at all. So it's better that even if you don't have any symptoms, let it be a part of your regular checkup to test your kidney, even if you're asymptomatic. Because once you develop those symptoms, it's already too late. And as I've said, most of kidney diseases are preventable.
Thank you, doctor. I mean, you got my question. I was trying to put it like, why should we not take it for granted? And I'm so happy you said that because it can't regenerate. Once the
Yes.
cells are dead, then they're dead.
Yes.
And then we run into trouble because we can't revive them. I'm glad you compared it to the liver. Well, it doesn't mean you should abuse your liver either, but it's an organ that can regenerate. Okay, doctor, just something about 10 or 14 years ago, maybe even 15 years ago, I heard that kidney problems were going to be on the rise for the Filipino population. And in the last 5 years or so, it seems that, I mean, I don't know, because of my previous occupations, I don't know if I was just exposed to a lot of people who have kidney problems and need help, like with, or who have CKD or all of that. But I don't know if it's just because of the nature of the occupations I took, but in your practice or in your experience, have you seen that kind of prediction? I guess not a prediction because it was a study, where you can estimate. Have you seen that there are kidney problems on the rise in the population, or do you get a lot more people with kidney problems in your practice over the last few years?
Yeah. Okay, the most common cause of kidney diseases are those patients with diabetes, followed by hypertension, and the rest are the primary kidney diseases. Nowadays, no, maybe because of the diet and the sedentary lifestyle, but most patients, so even at a younger age, they do develop diabetes, and as I've said, that's the most common cause. And aside from the diabetes, there's a constellation of syndromes, no. So when you have diabetes, no, it comes with it the hypertension, and then most patients with diabetes are also obese, no? And obesity per se, even if you're not diabetic or hypertensive, can make you develop kidney problems later on because, as I've said, the kidney is like a janitor of our body, no? If the area that it's going to clean is big, no, eventually it will have exhaustion, no? So just like the other kidney is absent, no, the process is also the same, no? If it needs to work harder because of the increased surface areas that it needs to clean. So, and also part of that also is our diet. No, why do we develop diabetes? Because we're fond of eating high sugar food, no, high carbohydrates, and we don't exercise. So those are the things that we need to adjust because if we maintain our sugar level, I'll talk about that somewhere later. But for now, just an introduction. Yeah. Okay. If we maintain our sugar level, we maintain our hypertension, we exercise, then basically we control the risk factors for the major risk factors for developing kidney disease.
So I guess I mean, like, it is true in a way because seeing how things were going, people could have predicted that people are becoming more sedentary. Definitely, there's less time. The traffic's worse. You end up eating whatever you can. All guilty of all these things. You end up eating whatever you can, and there's so many choices. The fondness of, and we can circle back to food later and diet, like for your recommendations and all that. And as you said, diabetes, diabetes I heard it would be on the rise also. And so I guess it's basically the way we live now. It's worse for our kidneys than it was before. Okay, right. Doctor. Thank you, doctor, for indulging me with my question about it. I remember that they were saying that it's just gonna get worse. And anyway, that's how I got that.
That's why right now the endocrinologists also are has this advocacy that to have a good control of your sugar because once as I've said, once you have good control of your sugar, good control of blood pressure, so we can delay the deterioration of your kidney function.
Thank you, doctor. Okay, actually, doctor, we just have to take a short break, doctor and audience. But when we get back, I will ask doctor many more questions and doctor will give me so much information. Please be patient with me, doctor. I'm this type of really inquisitive patient. Like if I were in your office asking you stuff, you would probably want to bop me on the head. But it's also I'd really like to raise awareness, and I'm sure there are so many people who could benefit from this show. First of all, raising awareness and whether or not they're into taking care of their kidneys. I'm sure they know someone, or maybe later on, it could be good for everyone. Okay, doctor, we're just gonna take a short break. Folks, we're gonna take a short break. Don't go anywhere. Just stay tuned to Healthline with Makati Med. We'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. 𝗂𝗍𝗂 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City. This is Dr. 𝗂𝗍𝗂 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗛𝗏𝗏𝗄𝗏. Available for outpatient care services, our 𝗛𝗏𝗏𝗄𝗏 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗛𝗏𝗏𝗄𝗏 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗛𝗏𝗏𝗄𝗏 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗛𝗏𝗏𝗄𝗏.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Okay, where am I? There I am. Thank you. Welcome back to Healthline with Makati Med. I couldn't see myself for a while. I am back, and I'm back with Dr. Sarmiento, and we're talking about proper kidney health. And where we left off was Dr. Sarmiento. You started mentioning like our diet. Of course, I asked you a question like, I mean, what is it occurring more often now, and all of these things. So, doctor, let's for the sake of proper kidney care, let's go to that part. Like, what role does the diet play in maintaining healthy kidneys. You say, let's say in an average individual. I mean, yeah. So we can start there because I know there are some people who are already sick. Blah blah blah. But let's start there with the average individual.
Yeah. Okay. On a daily basis, no, there should be a proper balance between amongst all the micronutrients that we need to take. The micronutrients are the carbohydrates, fats, and
Mhm.
protein. For carbohydrates, we need to be taking at least 45 to 60% of that in our meal. For
Mhm.
fats, at least 25 to 30, and for a protein, at least 10 to 25%. So in our plate, there should be proper percentages of those food.
Yes.
Now, what's happening now is because of the fad diet. There are some people or most people that who comes to my clinic, they would remove carbohydrates from their meal, and what they would retain are just protein and fats. So in other words, speaking of the kidneys, so if you take in so much protein in your diet that you don't eat a rice at all you eat are the steaks or all the viands that you have, the tendency for the kidney is to overwork because it would try to metabolize those excess protein. So the tendency is for our kidney to overwork, and as I mentioned earlier, the same process. Once you overwork your kidney, it develops inflammation and it becomes scarred later on, so it becomes non-functional. So I always tell my patient that the proper way to diet is, of course, eat everything in moderation. So there's a little some carbohydrates, some fats and protein for you to have those macronutrients, because it's not a proper that you only have a certain kind of nutrients and you don't have the carbohydrates, no? And if you take in so much protein, also then your body would shift into ketogenic state, no? Kaya nga there's such a thing as keto diet, no? And sometimes then it will be accompanied by intermittent fasting. So your body would sense that you are in a state of starvation. So eventually you would develop ketosis or your acidity of the body, no? So I always tell them that that's not the way to do it, no? A balanced diet, and of course in small amount, and of course increase your activity.
Thank you, doctor, and thank you for bringing up those diets because there's I'm glad you brought up to there's the keto diet, which I don't try the diets, but a long time ago, of course, yeah, dieting and whatever, trying to lose weight quickly and all that. But a lot of people are really into it. Like I know a bunch of them, and then at a certain they don't realize, like you mentioned, we should have a balanced diet, everything in moderation. Can I ask you how you define carbohydrates? Like aside from like rice or like starchy, are vegetables also defined as carbohydrates?
Yeah, vegetables are there considered fibers, no? So that to aid in our bowel movement. So carbohydrates like us, the starches like the bread, pasta, rice, no? And then the proteins though, that those are our viands, no? We can get the protein from the meat. Examples of that are beef, chicken, pork, no? And we can also get a protein from our plants, no? We call yung mga vegan, but sometimes it's not enough. We still need to have the high biologic value protein coming from animals, but it should be in an acceptable amount.
Thank you, doctor. More into the diets, because you mentioned it, there are a lot of people who will go into, like, they'll mix as you said, the keto with the intermittent and all of these things, and then there's also that what do you call this? Oh my god, I forgot the name, but where you
Intermittent fasting, is that?
no, it's like an old name already. It's all protein and like
Mhm.
some people will be eating like bacon and everything and eggs, but no carbs, and then slowly introduce them. Oh my gosh, I can't believe I forgot that. But these diets that people go on to lose weight or to look good or whatever it is, no, maybe they think, maybe there are some obese people who are on these diets so that they can get healthy, they can get lose weight faster. But the thing is, these diets can also damage the kidneys. I'm so glad
Yes.
you brought that up. I have one friend in particular. She is always like, she does the intermittent whatever. She eats healthy, but and then she exercises a lot, and she's saying like, how come I'm not losing weight? I'm telling her, because your body thinks it's starving.
Yeah, I think you're referring about the Atkins diet. No, those are
Yes,
the fat
Atkins
diets.
diet, exactly. I
The
can't believe
Atkins
I forgot.
diet, the paleo diet. Yeah,
Yeah.
those are the fad diet. Yes, because why are so people drawn into fad diet? Because you can get immediate result. No, if you do not take in carbohydrates, you eat lots of protein. Yes, you can get some weight loss in about a week or two. No, but it's not sustainable. No, and it's not healthy. After a couple of weeks, they have this term that keto fever. After a couple of weeks, then because the body is reacting to it, no, so you develop headache, weakness, and as I've said, no, your body would shift into a ketogenic state, no, and yeah, in the beginning it's all right, but it's not sustainable. So as I've said, no, there's no shortcut, no, you still need to do our proper exercise, and of course, everything should be in moderation when it comes to macronutrients. There's so plenty of that macro diet, of those fat diets, as I've mentioned, the Atkins diet, no, the keto diets, the paleo diet, and all of those. So they are generally speaking, they are called fad diets.
Yes. And the fad diets, as you said, yeah, they can work for 2 weeks or whatever, but they're not sustainable. Even if you
Yes.
do it for 6 months, okay, you lost a lot of weight, but you start feeling weak, or you don't know, maybe, maybe it's affecting your kidneys, or you suddenly like just break down and eat everything again. Because there, as you said, there are no shortcuts. Okay. Okay. Doctor, since we're talking about food, can you mention a few, like just maybe like a general list of food? You mentioned the typical diet and the good diet that one should have, which is like everything in moderation. And I'm glad you mentioned there should be fat there. I mean, we can't function without fat. We can't function without sugar. We don't want our sugar to go too high, but
You don't
you know,
want it to go too low either. Yeah.
yeah, my hypoglycemia is scary also. And also, like, just like in general, you can't like think when you're not eating properly. If you don't have to be malnourished, why should you be? Okay. So doctor, can you just list some, like, maybe people would be curious, like some food that is like, shortly, like particular food, like that is good for the kidney, and then why? Let's do the good first, and then even just like three examples, and then food or drinks that are bad for the kidney, and then why.
Okay, maybe I would not explain it in terms of good or bad. Maybe it's in terms of quantity, no? Because
Yes.
okay, in let's talk about steak, no? In a normal person, our body could take in 1.2 to 2 grams of protein in a day. So for example, you're weighing 50 kilos, so you 1.2, so it's about 1.2 times 50, so about 50 grams of steak. Then you are allowed to take in that amount, no? So but if you already have kidney disease, of course you will take much smaller than that. Then for instance, a fish, no? Then for us to be able to achieve that kind of 1.2 to 2 grams, maybe a size of the fish as big as your palm, no, that would be enough. No, it's not the kind of fish, it's the quantity, it's the amount.
Quantity.
No?
Okay. All right.
Mhm.
Thank you, doctor. I mean, that makes things so much clearer, because we can start like, I especially now with the internet, everyone will hear this and research that, and they'll be like, I'm gonna go on this type of thing to make my kidney better, but it might not be the case. As you said, you're the expert. I mean, thank you for telling people and for telling us, okay, you're allowed to eat it. It's the amount, which is
Yes.
also, I understand, also helps like with in terms of your weight, not getting obese. By the way, you mentioned obesity a few times as like one of the factors, and as you said, it's because that you gave a great explanation. I just want to point it out that if there's more of you, more of your body, more food, more things in there that the kidneys have to process. As you said, the kidneys like the janitor. There's more to clean, so the kidneys will get taxed more.
Overwork, yes. You're
Overwork.
taxing your kidney.
Yeah.
Yeah.
Thank you for
Mhm.
saying that, because sometimes it feels like every go-to thing, like, oh, obesity, and some people really have a hard time losing weight, and they're like, no, but it at least you explained why, and that's great. So I think that the way you said it will encourage people. Oh, okay, I'm gonna lose weight for that reason, not just because society is telling me to lose weight. Thank you, doctor. Thank you for explaining in that way. But can I also ask you, how do you define obese? Because there are calculations, right? Like somebody could maybe look thin but be obese. I mean, at a certain point. Like just maybe a general, how do you know when you're obese? Maybe just a general tip for us.
Yeah, because we have an ideal body weight, no? So if you're the nutritionist can compute this, no? They would assess, no, if you are overweight or not, no? And so that you will notice it if
Yeah.
if you're gaining weight, no? So and then you go see a nutritionist and ask for advice, then they will compute for your BMI, body mass index, no? So they will take your height and your weight, no? So if you're on that level na siguro mild and on the level of mild obesity, maybe do something about it, no?
Yeah.
There's they can just search in the internet the computation. You put in your height, you put in your weight there, huh? And yeah, and then
Yeah.
they could compute the BMI, and it will say whether you're already mild, moderate, or severely obese.
Thank you, doctor. Thank you for answering that question and for clearing up a lot of things. Because some people will say, maybe the person's just a little plump, but they're not obese. And
Yes.
then there's all of this also, like resistance with, well, at least I'm resistant to the obesity, and like how do you define obesity really? Okay, thank you, doctor, for all of that. Now, um, I'm so happy that you mentioned the amount of something, but when it comes to do you have any opinion, or do you want to do it later when it comes to, like, you'll often hear people say soft drinks are really bad, or this is really bad, or that's really bad, and you shouldn't take it at all for your kidneys,
Yes.
for your kidney health. Do you
Yeah,
have
because most soft drinks has sugar in it, no? And sugar, it's carbohydrate, no? So eventually, and if you don't exercise, then that sugar could get deposited in your body, no? Then in the form, it will be converted to carbohydrates or fats, no? And also, yeah, we're talking about food. If you're fond of eating rice, no, some of us kasi would eat rice, and then there's a pandesal pa. 1 cup of rice is equivalent to 4 pieces of pandesal. So you just choose which one do you want to. Would you like to have just rice, 1 cup, or maybe a half cup of rice or 2 pieces of pandesal? In that way, you already consume a cup of rice. And then for the soft drinks in general, they have sugar, no? Except but when they say it's Coke Zero, then there's no sugar in it. In fact, that's what we advise to our diabetic patient who really loves to take soft drink, but they can't get rid of other Coke addiction. No? So okay, say we would advise, okay, it's fine to take Coke Zero or Coke Light because there's no sugar in it.
okay? So when it comes to soft drinks, is it just the sugar, or is it also the sodium?
Yeah, and that's I'll get into that. No,
Okay.
there are some soft drinks that has a high sodium content. No, and it's not good also if you are already hypertensive. But if your kidney is normal, our body is especially the kidney has a way of getting rid of that excess sodium. But if taken in too much amount, the sodium level would increase also. That it will overwhelm your kidney. And aside from that, the soft drinks also has high in phosphorus. So we don't want your body to have high phosphorus level because it can get deposited in your tissue and the function will be affected.
Okay. Thank you, doctor. Thank you for explaining that part, because most times don't drink that, don't do that, don't do this, but it's also nice to understand why. So thank you for being very, like, generous and answering my what you call, like, very elementary questions to you, because okay, so we should watch in the drinks, mainly the fizzy drinks or whatever, anything actually you're saying is too much sugar, too much sodium, of course, like even when we eat, doctor, the salt. And then,
Right.
yeah, maybe if you want to circle back to that later, like certain foods, or when it comes to, like, taking care of the kidneys, we can do that.
Yeah, I can talk about since you mentioned salt, because they say what is low salt, no? Because all of us have different taste buds, no? What is salty for you may not be salty for me. So because our body needs salt also, because if the food is too bland, the person will not eat that anymore. So you taste it, no? If you think it's already tasty, the taste is enough for you, then you can appreciate the food. Then that's enough. But sometimes, no, if you think that it's still bland, then you can use some soy sauce or the fish sauce that we have, no? Because most of us, it's already tasted and we kept on adding more condiments, and that would add additional sodium level to your body. So as I've said, everything in moderation, because we don't want also to deprive the patient of the salt, because when we have there's a level to our salt in the body. If it's too low, we become so weak. Sometimes we admit those patients who has really low sodium low sodium level, because they don't take it so much. But let me address that further. The most common cause of low sodium in the body is not the high salt intake. It's because they take in too much water also. So to low salt and then high, coupled with a high intake of water, then that's the time that you develop low sodium in the blood, and that could make you weak. No? And sometimes we admit patients with a low sodium level. So I'll touch the water intake now.
Yes. I was gonna ask that next. Go ahead,
Yes,
doctor.
okay. When it comes to water intake, no, there is no hard and fast. Okay, you take 8 glasses of water, because it's a case-to-case basis, and also it depends on the environment. So, for instance, you are in a very hot environment, you're running. 8 glasses of water will not be enough, because you lose water in the sweat. You lose it in we have this insensible velocity that the water dissipates into the air. No, we call that insensible water losses also. So if you are in that situation, then you increase your water intake. But if you are just inside your house, you are in an air-conditioned place, and you don't feel thirsty, then maybe 6 to 8 glasses would be enough. And speaking of thirst, you should be guided by your thirst, because it's not good also if you are compulsive water drinking. There are some people na even if they're not thirsty, they kept on drinking water, then that overwhelms their kidney also.
Okay. Thank you, doctor, for saying all of that. First of all, as you said, there's no hard and fast rule. We've all heard the 5 to 8 glasses or 6 to 8 glasses, and like what size of glass, right? Because some people who don't want to drink water will be like, but I drank, but it's a shot glass. And then, so basically, you're also saying, I'll just recap that it depends on our environment. Yeah, of course, if you're running and swimming and doing all of these things, you are losing water through your sweat, and you're gonna get dehydrated if you say, I'm just gonna drink 8 glasses because I don't want to do too much. If you're sitting down and you don't feel that thirsty, then you don't need as much water. So we shouldn't be alarmed about a lot of us have heard this for years. So we're always like trying to drink like a whole pitcher of water to make sure we're okay. And as you said, that's also bad. I also thank you for bringing up the not having enough salt in the body can get you in trouble, because we need salt for our cells, right? I mean, to function properly.
Yeah.
Yeah, I forgot my chemistry and all that. Buti na lang pumasa ako, but geez, I forgot it. I took this class in college for organic chemistry, and I was like, what the? Anyway, but thank you, doctor, for making that so clear, because you won't usually hear that from other people, and we're getting it from an expert like you. And so the water intake, it's like, also, doctor, I understand that for some people, like we can touch on it later, but if they already have a kidney problem, I guess it's dispelling. They're not supposed to take as much water as well, right?
Well, as I've said, no, it depends. There are some patient who because there are several stages of kidney diseases, and if they're still in the early stages and they're urinating, it's all right to take in water. As I've said, no, your body would adapt, and of course, still guided by the thirst. But there are some patients who are already in the advanced stage of a kidney problem. That they don't develop urine anymore, or hardly any urine at all. Then that's the time that you limit your water intake. Otherwise, the water would accumulate, you'll develop edema, you'll develop pulmonary congestion. And yeah, it's hard when you're already in that stage, no, the advanced stage already, that everything is limited, even the water intake that you take, the water that you would take. And some patients of ours, so we would advise that if they're really thirsty and they're not urinating anymore, we would tell them to just eat ice chips, no? So in that way, they could quench their thirst, no, without adding too much water.
Thank you, doctor. That's I think that's important to know, and that's actually part of like dispelling myths and stuff, which we can circle back to later because I know
Yes.
you have all this information and even like a picture chart that you'd like to share with us. But please indulge me with my questions also. Okay, thank you for indulging with my questions. Okay, doctor, what about one of the most common things that we hear as kidney stone, yung sakit sa bato, ganyan, and then.
Yes.
Okay, can you tell us about kidney stones and how they're formed?
Okay, kidney stone is also one of the kidney disorders that we develop. No, kidney stones is like a hard material made of minerals and salt. It's like a stone that you see on the ground. No, the stone is like that. No, when a patient would pass out stone, or sometimes during operation that the surgeon will pick up the stone. It's like a stone that we see on the ground. How do we develop stones? So no, in our urine, no, or in the urinary tract, there are some crystals, no, that like the calcium oxalate, the uric acid. There are so many crystals, and that's the reason that we need to take in enough water to be able to increase the urine flow and to be able to excrete those crystals. But if you're not taking enough water, and so the tendency, if there will be low urine volume, and the tendency for those crystals is to attach to each other, then eventually it will become a stone. And aside from that, the habit of drinking water, another common cause of kidney stone is, of course, the diet, and of course, the genes also, heredity. It's especially more common in males, no? And that we can't do anything about. But we can, of course, adjust our diet if your family history of kidney stone is really high. But the most important factor to prevent the development of kidney stone is, of course, you increase your water intake and watch out your diet. You'll notice, no, parang it's contrary to what I've said earlier, di ba?
No, but it depends. It makes sense, doctor, because you're saying that that's if you're prone to getting kidney stones or you have kidney stones, then it
Yes.
basically there's you didn't get enough water. Go ahead, doctor.
Yes, because if you develop stones already, then once a stone former, you are forever a stone former. No, it may disappear, but eventually it could come back. No, if you do not practice proper eating habit, that you take in too much meat, then you don't take enough water. And another thing that's most common nowadays, because of this whitening, no, that they would want to do to their skin, they would take in too much vitamin C. And vitamin C in higher amount, the byproduct of that is oxalic acid. Oxalic acid, it will bind to calcium. That's the most common cause of kidney stone. So it becomes calcium oxalate. So that's why I always advise my patient na, which do you prefer? You are very white or you develop a kidney stone? So there has to be a balance.
Yeah, that's great, doctor. I mean, because everything that you're saying also is, I just want to commend you, and I'm so happy you're on the show. I'm really enjoying this conversation because everything you're saying is also so relatable to real life and situations, and it comes with fad diets, it comes with people wanting to look good. Now, it's not about judging them for what they want, but it's there, it's part of our lives, it's so relatable. Like, you think you're okay and you're beautifying yourself or whatever it is you want to do, or you're taking vitamins but to make yourself strong or white or whatever it is, but these things apparently affect your kidneys. And doesn't also, like, too much vitamin C, it can calcify also, not just like in the kidney stone, but I guess I'm asking you, and please correct me if I'm wrong, but can it also like be bad for some of your, I don't know, arteries, or like, there's it causes calcification in other areas, or is it just the kidney and that?
Well, it's more on the kidneys. It's byproduct. No, calcification maybe is brought about by the high calcium levels. No, if you're fond of eating mga high calcium products, so mga milk or cheese, so it can also cause a high calcium level. And but I've said, you combine high calcium intake, combine that with vitamin C, you have a perfect nidus for stone formation. And as that can be avoided because you don't need to take in our daily activities, you don't need to take in a higher doses of vitamin C. In fact, if you're eating properly, you can have your source of vitamin C from citrus like oranges, no, or any citrus fruit. If you don't if you really want to, if you don't like to eat fruits, no, multivitamins, it has all the vitamins in there, but in smaller amount that is acceptable. But as I always tell my patient, if you're eating enough, you don't need those all those vitamins if you're eating properly.
There, doctor, I am so happy you mentioned that for personal reasons also. But just I know a lot of people. I'm close to them. They take so many supplements. Okay,
Mhm.
there's the probiotic, there's the vitamin, but I think it's gotten to a point where for some people it's just really too much. There's like 2 pills of, I don't know, lecithin, there's vitamin E, and I'm like, please take that out. Please take, when they ask for advice, ask your doctor, take that out. Supplements are supposed to be supplements, but as you said, some people think, hey, it's great. I have a really high vitamin D level, but then apparently that's, there's something that it could affect,
Right.
the kidneys, or hey, it's great. I have really high potassium level, but apparently if you have high potassium level, maybe you should
It's
check
not
your
good also, yeah, because it's not
yeah.
good for the heart. So as I've said, no, there has to be a balance, everything in moderation, because we don't want you to develop hypervitaminosis. So there are several symptoms for that also. And you mentioned vitamin D. We Filipinos, it's very sunny here in the Philippines, so we seldom develop vitamin D deficiency unless you are bedridden, you're not exposed to any sunlight. So you don't need those supplements, no? Unless, as I've said, you are bedridden, or you are your patients with malignant, you have a patient with malignancy that they don't eat properly, then I think supplements are warranted.
Thank you, doctor. I'm just amazed. Like, it touched on so many things that I'm sure when people, at least a lot of people I watch this, they will be like, oh, okay. Then they'll like start arguing and redoing their whole supplement thing again and whatever it is. Okay, so and I did not realize that a lot of people or take vitamin C to get white. How
Oh
does that?
yes, they said it's whitening, and most of them would get vitamin C injection, or the tablet that they would take is really high. Let's say more than a 1 gram a day, no, sometimes 2 grams in a day.
You're just
And
gonna see that out, right?
yes, it's very hard for us. If your kidney stone is small, then your body can excrete it out if it's like say zero point 0.2 to zero point 0.3, no, and it's still not in your ureter, that would be that would cause obstruction. But if it's really big, and it will cause obstruction, then eventually your kidney function will be affected also, because the urine will not be able to go out because it is blocked by the stone, no. Mhm.
Doctor, where are kidney stones usually located? You mentioned the ureter. Are they located just there? Are they located in sometimes in the kidneys? Are they located in the bladder? Could
Yeah.
you tell us more about that?
Yeah, kidney stone can develop anywhere, no? But mostly it's in the kidney. So just imagine, so you have your two vein kidney, and
Mm.
then below that two vein kidney is the ureter, is the tube, no, where the urine is from in the kidney, and then the urine would pass out in the ureter, and then the bladder is the receptacle of the urine.
Mm.
So we don't want, if the stone is still in the kidney and
Yeah.
still not causing obstruction, depending on the size, then we could still do some medication for that, no. We will give medication, or sometimes there is a procedure, no, so that we prevent that from, we address that right away. We don't want that to get lodged in the ureter. The urologist would do a procedure, the extracorporeal shock wave
Is
lithotripsy,
it
or
the
the
ultrasound?
ESWL. Mhm.
Like the ultrasound to melt the stone?
Yes.
Okay.
Yeah.
So cool. I mean, compared to before, you had to be opened up and take out the stone or whatever. Now you can either take medication or do that. Okay. And then, so after the bladder,
As long
so
as the stone is still not causing obstruction in the ureter. Because if the stone is causing obstruction already, then the medication will not be enough anymore. But sometimes there are, we have good urologists in Makati Med, no? So sometimes they would, to address that obstruction, they have certain procedure like ESWL or open surgery, no, depending on the location of the stones and the size of the stone.
So it's once it gets to the ureter, does the stone ever move to the bladder? Only if it can be peed out.
There's a chance that it could move into the bladder, but in the process, it will be very painful. Most patients would really scream in pain, because imagine that the ureter is so narrow, and then you lodge a stone in there. So the ureter will try to stretch, and in the process, no, your nerve endings are stimulated, so it's really very painful. Mhm.
And you would feel the pain like what in your lower back? Or
In your lower back. No, it's most of my patients would describe it as it's worse than giving birth. No, so can you imagine that? Huh? So so that's why we don't want that patient to reach that state of having obstructive uropathy or kidney deterioration brought about by the stone getting obstructed in the ureter. So while it is still small, we address that by giving medication or by doing referring to our urologist, and they will do an ESWL.
So basically, folks, the longer you wait and not address it, the
Yes, and the longer you do not address your diet, because even if you give we keep on giving you medication, but still you're not practicing your diet like a high meat intake, because okay, another cause of stone is the high uric acid level. Now the high uric it's a different kind of stone, no? It's crystals also that would get attached to each other and then they would form a stone. The most common cause of high uric acid are the meat, no, and of course yung like the internal organs, and of course the bean product also are high in uric acid. So it's not totally forbidden to eat those that I've mentioned, but as I've said earlier, in small amount or in moderation.
Thank you, doctor. And yes, okay, when somebody starts to develop uric acid, or they have, let's say they're on medication for uric acid, that's good for the kidneys though, right? I mean, anything that
Yes.
stops uric acid is good for the kidney. Okay, just double check. All right.
Mhm.
So, okay, doctor. So, thank you for discussing the kidney stone in detail. Because it's something that I really think people should know. Stone, they don't even know where the stone is. What's a distal stone, or distal when you see that?
So that when you say distal, in layman's term, it's meaning on the lower part, no? So the distal, it could mean it is lodged in the ureter, or it could be in the bladder already. It's all right if it's in the bladder. There's a chance that you could still excrete it out. So on the more distal part, no, so it could be the ureter, no? So there's the high. It's good that if the small stone is still small, that it could still pass the ureter and in the bladder to be urinated, no? But the proximal, yung mga those are the stones in the higher up of the kidney. So that's the proximal.
Okay. So the distal, it means it's lower, it could be there. But of course, if it was a very big stone, you would already, I mean, the patient would already be like, as you said, it's worse, harder, more painful than giving birth.
Yeah,
Thank you.
that's why when you have kidney stone, I always tell them that if it's still small, we treat you, and then we monitor it by having an ultrasound every 6 months, so we can determine the size, no, whether it's getting bigger, is it getting smaller. Because there are some medication when you take it, no, it would pulverize the stone, no, so that you would excrete it in the form of sandy materials.
Okay. And then, doctor, just to double check, you said earlier, like, when somebody, the water intake, when somebody cannot urinate anymore or form urine, that's when you limit it, no? Okay. And
Yes.
but if somebody has, okay, I'm gonna get into kidney function and stuff in a bit, so maybe we should get into that first. So,
Yeah.
okay, doctor. Now, can we talk about, like, so when do you think someone should see a doctor? Like, what symptoms are there, or is there like a number of symptoms, like not just one, but if you have these 3 symptoms, you should then see a doctor, a nephrologist, or like maybe you have a kidney problem. Could you talk just an overview? Could you talk about that a bit, doctor?
Yeah, that's the issue with kidney disease. Most patients, they don't develop, as I mentioned earlier, they don't develop symptoms at all. And once they develop symptoms, it's already late in the stage. So don't wait for your symptoms to appear. But if you know that you have those risk factors that I've mentioned, the diabetes, the hypertension, obesity, high cholesterol, then it's about time that part of your annual checkup there should be creatinine. Those are the blood tests for the kidney, and the urinalysis. So in that way, the nephrologist could compute your eGFR. That's estimated GFR. That's how we compute your kidney function. And in that way, we would know what stage you are in, so we can address it by advising you how to delay it, by advising you to have low protein diet, and there are some medication nowadays that are available, because we don't want them to become malnourished, so we have some medication for that. And we once you develop, let's say you are already in the stage 3 of your kidney disease, you are more prone, your body is more prone to develop acidosis or acidity, because you're not able to excrete all of the waste product. Then we can give medication for that. And then for the stages of the kidney, so I'll mention it now. No, there are 5 stages of the kidney function. So normally, yun nga, 90 to 100%, no, that's a normal kidney function. When your kidney function is already less than 15%, that is already stage 5. Those are the patients that we dialyze.
Okay.
And then,
Are we
Mhm.
talking about is it all does it all of these stages, do they fall under the umbrella of CKD or chronic
Yes,
kidney
yes,
disease?
those are chronic kidney disease. The one that I just mentioned is chronic CKD stage 5. That's less than 15%.
Percent. Okay, doctor, let me ask you a few things. You did mention, okay, so basically, one of the scary things about getting kidney disease or having kidney problems is that you don't feel any symptoms. And by the
Yes.
time you feel it, okay, you're already in one stage of it, or you do have a kidney problem already. So it should be part of your yearly or whatever, whatever age you are. Because when you're younger, you take it for granted, or you also you're younger. I mean, your body is more can heal itself more. So, but when it comes to the checkup, okay, what should we include for we'll often get a blood test or let's say a spec 23 and they'll check all our cholesterol levels, and that's mostly what people are worried about, especially those who have been diagnosed with hypertension or who have had like a heart attack at some point or a stroke. But the kidneys kind of don't get enough attention, no? So one would be, okay, when you take a test, the creatinine level is important. Um,
Creatinine, urinalysis, your basic checkup, and also the ultrasound also of the kidney, especially if you are hypertensive. So we can see the size of your kidney. Part of the initial workup, it would be the ultrasound, urinalysis, and the creatinine. And
okay.
by the way, you mentioned that if you have symptoms that sometimes you may be already in the stage 3 or stage 3B or stage 2 of kidney disease, and you still don't develop symptoms because your body, the kidney are still able to excrete those waste products. There are some patients that would start to manifest symptoms when they are already in the stage 4 or stage 5. And I've always tell my patient, let's not wait for your kidney function to reach stage 4 or stage 5. So as early as now, let's monitor your kidney. So we could monitor your creatinine every 3 to 6 months. No, I always tell them that. So we can address it right away when we find out that your your creatinine level would start to go out.
Okay, so doctor, basically, just if folks out there, when we talk about creatinine levels, that's done through a blood test, a simple blood
Yes.
test. And to get the other, let's say you want to know your cholesterol or sugar, you usually do have to fast, like if you get something like a spec 23 or your lipid profile. But to get to find out the creatinine, you don't need to fast, right?
You don't need fasting. Yeah. Mhm.
The creatinine level, and then there's the EGFR, which is the estimated
Glomerular filtration rate. Yeah. The EGFR.
that's
Mhm.
also through a blood test. And then how do you compute it, by gender and age? Or there was a time when people were asking, I mean, somebody got a GFR test, and then somebody called back, a lab called back and said, how much does she weigh? And I was like, what do you mean, how much does she weigh? You should
Yeah,
have.
yeah. There are several ways of computing for the EGFR. So in my practice, I use the Cockcroft-Engold. It includes the age and the weight of the patient. And of course, the creatinine level, that is the value of that creatinine is the one that we use in computing for EGFR.
So they work together. Okay.
Yes, so sometimes in our laboratory, that's why the medtech would weigh you so that when the result comes out, your GFR is already there. No? So as nephrologists, it's a less job for us because we don't need to compute it again. But for me, no, even if there's already a GFR, who knows, maybe he collected that creatinine maybe a week ago and then he already gained some weight. No? So there's already a change. Yeah.
And then let's go to when do you recommend someone to get like a kidney test, nuclear medicine, to get the GFR nuclear medicine? What is that like? What's the procedure like? Also, just so our audience also knows what they have to go through. Basically, the others are just blood tests. And then what about, like, let's say to get the GFR in
Nuclear
the
GFR, yeah. Okay, there's as I've said, there are many ways of determining your EGFR. One of that is blood, and then you mentioned the nuclear EGFR. Nuclear EGFR is a scanning procedure. No, we have that in our nuclear laboratory. No, it will determine the function of your left and right kidney. As I've said earlier, the function of the kidney. No, when you have two kidneys, the function of that is 50-50. But there are some cases now the patient would come to me kidney, and then there's only one kidney, then of course I would determine the function of that remaining kidney. There are also cases that the patient would undergo kidney transplant, so we will do the GFR study, so we would know which kidney to take out, no, whether it depends case to case basis, so depending on the function of those kidneys. There are some patients that the other kidney has already developed stone, that the stone is too big, that the function of this kidney is already the function of the kidney is really low, that it needs to be taken out. And then that's the time also that we do a nuclear EGFR, so that we would determine the function of the remaining kidney.
Thank you, doctor. And then one more thing about the GFR. And basically, because it's telling you how the kidney is functioning, you did mention, okay, 90 to 100, great, you're fine. And then there's sometimes people will say, well, as long as you're over 60, you're still okay. And then just age. But I mean, and then, 40, that's pretty scary already. And
40,
then
that's stage 3, but still okay. It's still okay.
Okay. I'm starting to panic, getting nervous for things. And then, okay, so recently I someone I know had tested, and then they said suddenly from 40, like, I don't know, in a few months, it dropped down to 19.
Okay,
So
that's stage 4. So it's in a span of several, if it's just a short time, I mean a small period of time, that from 40
year,
to
I'm sorry,
19,
6 months to 1 year.
6 months to 1 year. Oh yeah, because normally there's such a thing as this aging kidney. You know, when we age, also our kidney function goes down. No, let's say from 1 to 2% in a year. No, that's that's given already. But if there is an acute component, what do you mean by acute component? Maybe you develop diarrhea, you got sick. No, that your kidney function from 40, it became 19 because there was a superimposition of an acute kidney injury, like diarrhea, vomiting, infection.
And could it be like there's a stone pala? That's
Yes,
why
the stone that that obstruct your kidney what they call this, the passage of the urine.
And then, well, when her kidney test was done again, this is a real case, doctor, that we are studying online. It became 20 something. So her her EGFR. So what do you think?
So as I've said, there could be an acute component that triggered while the kidney function further went down. So let's hope that that acute component is addressed. Like if it's a kidney stone, let's take out that stone. If it's diarrhea, then let's hydrate the patient in hope that it will go back to where it was, the 40%. No, but sometimes say for example, the stone has been. It took some time for the stone to be taken out. So maybe the kidney will not go back to where it was. It may go, it may improve a little, but not that much.
Okay. Thank you, doctor. I mean, I know people, who have problems with their kidneys, and you're explaining it this way gives them hope, but also you're being realistic about it. And it calms people down, including me, because since I know the people, I get nervous about it. Okay, doctor. So, can we talk about, maybe we've talked about like the tests that how often do you recommend someone should take the test, like for the kidney function, the creatinine, get the EGFR computed and all of that? How often?
If it's just part of your regular checkup, no, you're not diabetic, you're not hypertensive, then once a year is okay. But if you are starting to develop diabetes and hypertension, maybe every 6 months. But the BUN and creatinine and also the urinalysis. But if you're already in that CKD stage, no, I would advise every 3 months.
Every 3 months, okay.
Especially if you're already in stage 3.
Yeah, okay. Doctor, can you tell us, okay, why diabetes and why hypertension?
Okay, it's like this. When you have diabetes, no, when you're if your kidney is exposed to high sugar level, the tendency of the kidney is to excrete the excess sugar in our body. But if the sugar level is too high that it already overwhelmed the kidney, then you overwork again your kidney. The same process that I've mentioned earlier, no? So the kidney will do hyperfiltration. It will increase its workload against it. The process is repeated. It will develop inflammation. It will develop fibrosis. Plus the sugar per se is also inflammatory. The sugar itself is also inflammatory to the kidney. But in the process of, if you take in high sugar, of course, when you take in high sugar, the kidney will try to get rid of the excess sugar. But if the level is too high, no, that you overwhelm the kidney, then as I've said, no, you again subject the kidney to increased workload. And then with regards to the hypertension, because with the high blood pressure, your kidney is always exposed to the high blood pressure. And when you expose to the high blood pressure, that also injures the kidney, no? The high blood pressure. There is what they call this complex interplay of system in the kidney, that when you are exposed, it's already biochemical and medical. But when you are exposed to a high blood pressure, there is a compensatory mechanism. But eventually, the kidney can handle that. No, I mean, in the beginning, the kidney can handle that, but eventually, the high blood pressure would again be too much for the kidney to handle.
So doctor, basically, like in layman's terms for people like me, the kidney also helps balance the blood pressure in the body.
Oh yes, of course. How by when you have as I've said, okay, let's talk about hypertension. Most people who are hypersensitive, they take in too much salt, no? And too much salt, you attract water and eat, so you retain salt in the body, then that elevates your blood pressure. But if your kidney is okay, then no problem, you just excrete the excess salt. But yun nga, if the kidney is already deranged or brought about by the hypertension and the diabetes, so it's like chicken and egg, you don't know which one came first na, no? So if your kidney function is deranged, you won't be able to excrete the excess salt. So that's why you further aggravate you develop hypertension, then you further aggravate the kidney condition.
As you said, there is that complex interplay between and the heart and the blood pressure always pumping.
Yes.
You explained it so well. Well, if you have high blood pressure, let's say you're eating a lot of salt, you're retaining water. If your kidneys can't get rid of it, then it damages them too, because it helps balance, and then your blood pressure rise. So it's all, when you have hypertension, you take care of your kidneys too, and your kidneys are trying to help you with that type, how do you say this? Keep your blood pressure steady. And then for the diabetes, it's the overworking due to the excess sugar in the body. Thank you, Doc. I mean, thank you for indulging me with all these questions. And then, are there kidney diseases? If we've discussed them, it's okay, but are genetic or familial? Like, you could just get it even if you cared for yourself very well when it's your kidneys.
Yes, there are some people who are born with a predisposition, primary kidney diseases. Sometimes we don't know where it came from, no. So that's why there is such a thing as a the pediatric nephrology. So at a younger age, no, the kids are screened for urinalysis and creatinine, because especially if they have a family history of mga primary glomerulonephritis. So those are primary kidney diseases, and that's the third most common causes of kidney disease.
Yes. I remember I had a relative who had to be treated when he was in high school. So so there are, you don't really know where it comes from, but they have these illnesses.
They have the genes for that, no? Or sometimes in the routine physical exam, no, doctor, I don't feel anything, no, but I noticed that I've been having this red blood cell in the urine, or I have proteins in the urine. Then when we do sabi ko, since when did you notice that you have blood in the urine? Oh, since high school. And how come you did not do anything about it? Because they don't feel anything at all. So when we do some workup, and we part of that workup is by doing a kidney biopsy, the kidney biopsy would come out that the kidney is already fibrotic, meaning to say it's scarred already. That means the kidney problem has been there for quite some time. So it's important that as a kid, that part of the workup also would be the creatinine and urinalysis.
I'm getting from you that you're really stressing the urinalysis, and that's something that a lot of people will, like, at the end of the test, I'm just gonna skip it. Just like the stool sample, which is important. So don't skip the urinalysis. And the urinalysis, just to things that one thing that we do on the show is like I like to explain what the process is so people don't freak out. Like in terms of the urinalysis, well, I think it's you pee in a cup basically. And then correct me if I'm wrong, doctor, but the proper way is you pee and then the first pee you don't collect it. It's like the midstream.
Midstream, yes. So that
Right.
you don't put the contaminants. So because our skin has contaminants also, if you catch from the very beginning, it could be contaminated with our epithelial cells, no, the cells from the skin, and we don't want the contaminated urine. So we want it midstream, no. So the first you flow has already cleaned the area, and then so you catch it, then stop and then submit it right away, so it does not become stagnant.
Yes. Okay. Okay. Thank you, doctor. Okay. So, okay. Let's get down to your like. This is human. You got the floor, doctor. Thank you for answering my questions. Like, are there habits or that behaviors? I know you've mentioned it already. You've touched on it, but just let loose and tell us about like habits and behaviors people might have that they don't realize they're harming their kidneys, and then let's start there. Okay.
Yeah. Okay, so as I've said, no, all of the kidney diseases are preventable. No, just follow good exercise, proper diet. No, eat healthy, monitor your blood pressure, monitor your sugar level, avoid smoking. Oh, but by the way, I'll mention about smoking because when you smoke, no, it hardens your artery and it's there. No, so this is the golden rules to protect your kidney. No,
Okay, would you like to show your slide, doctor? Okay, there you go. Okay. Thank you for preparing this. You have 8 golden rules to protect your kidneys. Go ahead, doctor.
yeah, because this March 14, we will be developing, we will be having our World Kidney Day. No, so to create awareness, no, that kidney diseases are preventable. No, so how do you prevent that? We just practice these 8 golden rules to protect your kidney. So number 1 is you exercise. Number 2, you drink, no, not too much, not too little also. No, but you just balance it. You should be guided by your thirst. Number 3 is good sugar control because as I've mentioned, no, the high sugar level would make your kidney overwork. Then eventually you could develop fibrosis and scarring. You control your blood pressure because the blood pressure also, if your kidney is exposed to high blood pressure, then there's an interplay there of the system, but eventually your kidney function will be affected also. And then next is, of course, proper diet, not so much protein. But there should be a balance between carbohydrate, fats, and proteins. No smoking also.
Why no smoking again?
Yeah, because it can harden your artery and it can make your blood pressure level go up. And of course, exercise. Yeah.
Okay. Okay. Of course, no doctor will endorse smoking. I know that. But if people have to smoke, maybe they could like smoke less or something if they really can't stop. You will say no,
Yeah.
they have to stop. Okay, we get that. We understand why. So guys, it's smoking. It hardens your arteries, and that is bad for everything basically.
Yeah.
And
Not only the kidneys. Yeah.
not only the kidneys, and as we said, there's an interplay between the kidneys and controlling the blood pressure, and then there's also all these other factors. So doctor, when you mention exercise though, can I ask you, like, how about in patients who are persons with disabilities and they can't exercise? How do you manage that as their doctor, or how would you, what advice would you give? Let's say, first define exercise. Like for us, what is good moderate exercise? Because some people will go overboard and like just
Yes, because there's a limit to what our body can take, no, can handle. No? Because there are some patients who are really obsessed in going to the gym that they would exercise for 2 hours, no, and then that's not good also because your muscle would be injured and you would develop this rhabdomyolysis. You would develop kidney injury because the muscle breakdown brought about by the too much exercise it get deposited in the kidney also. So it's not good also. When we say proper exercise, sometimes kasi you must have a goal. Okay, I would want to reach this goal. I would want to lose this certain amount of weight. You don't do it drastically. Of course, you start very slow. Okay, today I would walk 5 minutes. Tomorrow I would walk 10 minutes until you get to that comfortable level that you're not that exhausted, but you're not too but it's not too little also that it feels like you did not do any exercise at all. So, as long as you keep on doing something that's increasing your heart rate, we call that cardiovascular exercise. Brisk walking is a good exercise also, no? You do not need to lift any heavy object, no? As I've said, walking, dancing, any cardiovascular cardiovascular exercise is good because it increases your metabolism. And then when your metabolism it increases, no, it helps burn those extra cholesterol, those fats that you don't need.
Thank you, doctor. So it's more of like aerobic exercise, meaning exercise that gets your heart rate up.
Yes.
Things as human beings, like we walk. So try to walk. How about those patients though? How do you manage patients who, let's say they developed an injury, or they're a person with a disability, or let's say they're older and they can't walk around that much anymore, or they have a broken bone in their body or something like that. How would exercise come into play in that sense, and how would you define exercise?
Yeah, okay. In that case, so in patients with disability, there's such a thing. We have professionals who can assist in the physical therapy. So sometimes they have these mga dumbbells that were rolling, so that in other words, even if they can't physically do it on their own, it's called passive exercise. No, it's like really that they don't do anything, so that it won't stiffen their joints. Of course, it's very hard for the disabled people to really do active exercise. So sometimes it's impossible. So we need the assistance of the professionals. But just make sure that there is some what they call this stretching, bending, flexing of the joints, so that it does not harden.
Yes, and for those who are really weakened at this stage, the professionals that you said, the physical therapists or physiotherapists, they can help you move the muscles for you. And even such things as like flexing your feet and your blood pressure and things like that.
Improves the circulation as well. And as I've said, the walking is just one of the examples of cardiovascular exercise. There are some patients who find it difficult to walk, but they can swim. Swimming is also a good exercise, huh? Mm-hmm.
That's me.
Like swimming?
I never really get to, but there's an example, like I was not feeling well, whatever, but I went to the beach for once. I hardly go, and my nieces, who are actually they exercise a lot, like they're involved in that industry, as teachers and all of that. We went out in the ocean, and then I jumped off the boat, and they were like, "Oh my God, Tita, you're like a different animal in the water." I was like, yeah. So
exercise, yeah.
Yeah, if only we could all have pools or something, but not expensive. But figure out what you can do.
Yeah, there are some patients who does not like going to the gym. They would like to walk in an open area like the park. That's also okay. In my case, I do during my rounds. So when I make my rounds, I don't use our elevator. I seldom use our elevator. I use the stairs. So that will serve as my exercise also.
Yeah, that's it. That's your exercise also. And then people also get obsessed about steps. The 10,000 steps a day. Of course, it's good if you can do 20,000 steps or whatever. But if you can't, don't feel so.
Don't feel so bad about it. Say, then you can just do it in staggered. Okay, as I've said, I'll walk 5 to 10 minutes this morning, or in 5 to 10 minutes this afternoon. So for as long as you're not sedentary, because for example, you work in your job is a desk type job, so it's considered sedentary. So do something, not to compensate for that time that you were seated. No, at least do some walking. But for us doctors, we do some make around, so we fall on that moderate type of activity.
Yes. You do your rounds, you walk around, and then you're thinking. It's great that you mentioned like ways to do it, like don't use the elevator, use the stairs. I use the stairs going down. I used to do that, like, I can run to the 10th floor and run down, but now I'm like, going down. Yeah. I used to like make a habit of running up and down in the office, like using the stairs, but not these days. Who knows? Might get back to it. You never know.
Who knows? Yeah.
Or give me a pool and I'm like, just like a little a fish. Okay. So anyway, doctor, thank you there's also like people who like to do stationary biking. That's okay too, right?
Biking is also okay. Yeah, it's safer, no, but for other people that they want to bike on the street, so that's all right also, for as long as you have an activity. Sometimes you can just dance on your own. You open your YouTube, follow some dance steps there. That's also all right as a form of cardiovascular exercise as well.
Do you think that housework and cleaning, washing dishes, walking around, picking up things. Do you think that that qualifies as exercise?
Those are household chores. Sometimes it will not increase your heart rate. As I've said, it should increase your heart rate to be able to increase also your metabolism. It will increase to a certain level. But maybe siguro if you're running, going to the kitchen, going to the living room, then eventually it could increase your heart rate as well. No, but ordinary household, I won't consider that as exercise. But at least you're not sedentary. You're still burning some calories doing that. Mhm.
Okay, so I'm not gonna do that.
Okay.
Doctor. Okay, so doctor, can we talk about can we talk about how age impacts kidney health? You did mention it already earlier that when you're older,
Yeah. Yeah, because there is such a thing as an aging kidney. We have this chronic kidney disease of aging, no? Because as we grow old, like all our cells, no, it also declines in function. So they say no. Once we reach the age of 50 and above, our kidney function starts to go down to 1 to 2% in a year, and that's all right. That's the normal process, talaga, and we can't do anything about it. But it could be your kidney function could go down faster if you would say indulge on a high protein diet. You would increase your weight. But if your kidney function would go down as if it's just aging naturally, then it's a normal process. Then it's okay.
So doctor, if you have a 90-year-old with 20, with let's say an EGFR of 20 or less than 40, you don't panic as much because it's a natural
90,
age.
90 years old with the EGFR of 40, I won't panic. Still very good for a 90-year-old.
And
Okay, for 20, then it is expected. As I've said, 20% is not yet a dialysis level. If he does not have any symptoms like nausea and vomiting, then we just support pa rin the low. We just still advise the low protein diet, control the blood pressure, unless that he has symptoms of edema, pulmonary congestion, high potassium. Then we have an indication for dialysis if the EGFR is already 20. By the way, in patients with diabetes, we start dialysis once the kidney function goes down to 20%. It's earlier. But in patients with hypertension, we start it much later. We start at 15%. But sometimes, even if they're not yet on that level, if they develop the symptoms, then we do dialysis right away. So on a 90-year-old patient without symptoms and the potassium level still okay, then we don't do dialysis. No, we just manage the diet, the medication.
so on a 90-year-old, the potassium level was high. So what happened was all bananas, potatoes, and anything with too much potassium was banned.
Yeah.
Pero-
Most foods has high potassium. No, it's not totally zero, but siguro he will, instead of eating the whole banana, just half of that. No, instead of eating whole mango, just half of that. 5 pieces of Lasonis grapes. So kasi because our body needs some fiber, some form of fiber also. But in CKD patient, we just try to advise them to eat a little amount lang, no, not so much.
But maybe like grapes are better than banana because banana is really high in
They're really
potassium.
high in potassium, yeah, but in the end, they're just all the same. They're fruit. They have potassium.
Yeah, but we also need potassium. We can't
Yes, of course. That's why there's because there's a very narrow of lang talaga of period lang, narrow level of potassium, 3.5 to 4.5. Anything beyond that, it's higher or lower, no? And both has a detrimental effect to the heart. Both are in
we don't have to like stress too much if the potassium came out high because it could go low. And at the same time, we don't want it to be too low because you can get a heart attack if you don't have enough potassium.
Yeah.
Doctor, okay. Is there anything that you'd like to talk about? I know I bombarded you with my questions. I hope you don't feel like killing me. I hope I can see you again. Do you give any lectures? I'd love to be there and keep asking you questions. I really, really enjoyed our conversation. Thank you for answering everything. You didn't back away from any answer. And you're like, it's maybe very elementary for you, but it really helps people like me who care about other people, and it could help so many other people who will listen and view this show. And you are very, very intelligent and very exact, but you still know how to communicate with human beings like us. Is there anything like you'd like to say, like maybe advice you can give for I want to thank you for that, for your patience and for indulging me with all my questions, and for taking the time to be on the show. And I hope you take my call. And
Yeah.
also,
Yeah. Mhm.
and also, doctor, is there anything you'd like to say, like general advice, anything and anything you'd like to promote for kidney health? Please go ahead.
Yeah, okay. So as I mentioned earlier, no, most kidney diseases are preventable, no, and I have flashed earlier the 8 golden rules.
Can you flash the 8 golden rules again? Let's just keep it there.
Yeah, every year that's our advocacy. The Philippine Society of Nephrology has that yearly advocacy to inform our countrymen that the kidney diseases can be prevented. They just follow these 8 golden rules, and we will Makati World Kidney Day will be on March 14, and Makati Med is part of that. So in the lobby, no, our fellows has made some posters for that day, no, and the 8 golden rules will also be posted. And by the way, I forgot to tell you that there are some patients who is, as I've said, who is so obsessed into the gym. They want to gain more muscle, and they will take this protein supplement. It's not good also, huh? Yeah, because it's like taking higher amount of protein. I forgot to mention that. So it's like taking a higher amount of protein. In fact, it's even worse because that protein has it's really high, no, yung mga tinitake na protein supplement. So it's not good also.
Because they
So
want to build muscle, go to the gym.
Yeah, you don't need that. Okay.
Yeah, obviously, I was never that kind of person, but yes, I know many of them, and I know one who's listening right now. And see, this show may touch you. I know she's listening right now. Okay.
So yeah, with that, I just want to thank you, Nicole. No, you're very how will I say this well informed of the different kidney diseases, no? And yeah, again, no, as I've said, kidney diseases are preventable. We don't want you to reach dialysis. Okay.
Thank you, doctor. That was a nice way of saying ang kulit mo. But I have to leave for my job, and thank you for answering all the questions that I asked you, everything I threw at you. I mean, these are things I know that I personally know experience that people undergo when they go see a doctor and they ask for advice. And of course, we are not treating people on the air, because you can't do that. You can't treat a patient without seeing. But you gave so much information, like just a wealth of information. And it's so relevant because it comes with the diets, the gym, and everything. I mean, you talked about the elderly and people who are, maybe getting a bit older, middle age, but also it applies to a lot of young people. You did even mention like some children who are born with it, but also so many things that we do, like whether it's diets, we think we're being healthy, but we're actually stressing out our kidneys, and that could lead to problems later on. Okay, doctor, I'll give you the floor. Is there anyone you want to say hello to or bye to? We are actually out of time informed.
Yeah, just participate in our World Kidney Day celebration on March 14. Yeah,
Okay.
we'll see you at the lobby. Okay.
Thank you, Dr. Sarmiento.
Okay.
Thank you so much. Thank you for being in the show. I hope you come back again and tell us more about anything you'd like to discuss about the kidneys, or there's so much more that we could talk about.
Yes.
And with every conversation, new things come up. Thank you for being on the show. I hope to talk to you again soon. And maybe I won't be as makulit next time. We never know because it's live, so we never know. Thank you, Dr. Sarmiento.
Thank you. Bye.
Thank you for tuning in. Have fun with Makati Med, only here on DZRJ 810 AM Radio Bandido. And also Radio Bandido TV. And thank you, Dr. Sarmiento of Makati Med. Thank you, Makati Med, for booking Dr. Sarmiento to tell us all about kidney health. Today was a show where we can be proactive. So let's do it. Thank you, doctor. Thank you, everybody. See you next week. Have fun with Makati Med.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.